guys, it's time for the gray belt session. So what we're going to do is try to open up the core. So still with the MSA type of approach, we're going to do the myofascial release to the core, front part of the hip, and then the quads. Now the first one we start off with is a good old gut smash. This is fantastic. Sounds as this is awesome as it sounds. Take your good old Batman ball or Spider-Man, whatever, pick your poison, DC or Marvel. But what you're going to do is you can either get a soccer ball, volleyball if you wanted to. This one's not even really fully inflated, but this is what, like $1 at Walmart. So get one of these, and what we're going to do is we're going to have Haley flip over, and she's going to go on her belly. I typically start right at the belly button first, and what you're going to do is take a nice deep breath, let it all out, and just try to relax as much as you can. Deep breath in. I typically do 3 nice deep breaths because the more you contract your core, the more it pushes the ball away from the hip flexors and the iliopsoas area that we're trying to work on. Now, this will feel lovely. This will feel like what they call a kitten's gutting you from the inside kind of a thing. So once you're nice and deep, what Haley's going to do now is just slowly roll back and forth. Get the whole gut area. So I always tell people, think about like quadrants. If you were to kind of break your core up into 4 parts, work one part up here, maybe go to the other side for a little bit, hit that lower part, and then the other side. Now just, when you find an area that's tight, it's your area that's tight. Camp on it. Work on it for a little bit. Just breathe. It's a good pain, okay? Now the first 2 weeks of this, just like foam roller, is awful. It's pretty darn tight. You're just gonna sit there and concentrate, embrace the suck kind of thing. But yeah, enjoy this one. Okay, so the next one in the mobility or the myofascial release part is you take that trusty ball and you're gonna stick it right there on the front part of your hip. Okay, so Haley's gonna work her right side. Now, she's gonna kind of feel where it's at. Just kind of camp on it. You don't have to breathe. You don't really have to roll with this one. But if you're kind of curious to where it's at, right when you bend the leg, you follow it right where it turns into your pelvis, where it attaches right here. That's where you're going to put that ball. You're just going to sit right there. You can kind of roll around just in that area. Sometimes whenever you have that pressure, kind of like what Haley's doing, she's putting her foot on the ground and she's just going to internally and externally rotate her whole leg. Yep, so bring the leg that way. Perfect. You can go the other way. This one feels lovely. You're just kind of sitting there digging onto that front anterior capsule. Now, a lot of times people will get impingements through here as we sit all day. So this is a fantastic one to kind of help open up, especially if you're pinching at the bottom part of the squat, this front hip. Last one for the myofascial release. We're just going to kind of continue to that whole front half. Time to get the thigh muscle, your quad. So Haley's going to lay down on her thigh. And we've already done this one before, but you're just going to kind of really clean it out, go up and down, feel where you're tight at, and I want you to stop on it. And then she's going to flex and extend and really work that trigger point out in that thigh muscle. So this one's not rocket science, but it just gets really tight, especially if you have knee pain, hip pain, or back pain. All right, enjoy this one. All right, the next part is the S, stretching. So what we're going to do is we're going to attach a band, honestly a pretty thick band if you can, to something that's not going to move. So if you have one of those door attachments that comes a lot with these the pull-up bands, so you shut the door behind it, make sure it's either deadbolt or you're opening the door from the other side, so it's not opening up to you and slapping you in the rib cage or something like that. So the first one you do is you put your leg in the band and you actually have it right underneath your butt cheek area, okay? So what you do is you go to the ground, that knee to the ground that you have the leg in, and then you let it pull you forward. Now remember, the hip flexor's job is to cause hip flexion, so we want to extend the hip. Its secondary job is lumbar spine extension, so we want to flex the lumbar spine. So do like a little mini crunch, keep your core tight, and then let it nice and tall, and then let it pull you forward a little bit. I always tell once you get to the end, squeeze that same side butt cheek if you can, and what it does is it pushes that hip forward. Now to kind of accentuate this, what you can do is bring this arm up over your head, reach nice and tall, and then you can lean away. And what it does is it kind of gets that whole fascial area, the connective tissue in that whole front leg and the side. Now you can, this is an extra bonus, rotate this way. Good. Take that top hand, go to the knee. If you're mean, you can grab this foot, and there you're doing that pretzel stretch, that kind of turning, twisting move
but try not to arch here. I want you to really flex there and then squeeze that glute on this side, and it should really feel a stretch all the way across from one shoulder or one hip to the opposite shoulder. And you're gonna take this other leg and swing it back behind you. We're going to go into a pigeon stretch, but with a band assist. So what we're doing is causing external rotation at the hip. So with this one, you'll feel it a lot. You will. Just try to slowly sink down into it. You can even work down to the elbows. Breathe into it. And then if you can, you're going to slowly see if you can bring that shin up. And then try to bring this hip down if you can. All right. This is why we always kind of foam roll the hips a little bit before we do this one, because it's tight. Now, to accentuate the opposite arm, opposite leg type of fascial patterns that you have. So she is pretty much doing a front stretch on this hip here on the opposite leg. So we want to bring the other arm away. So what Haley's going to do is with her right arm, reach to the ceiling and kind of move that thoracic spine. You can be mean again and grab that leg. Okay? The next one is more of an internal rotation of the hip. So she's going to stay where she's at, but go into all fours. Good. Now you want a really good pull on this one. Okay, so what it's doing is it's pulling the hip that way, more of a distraction. Now what I'm going to have her do is bring this foot this way. So it's causing internal rotation here at the hip. All you're trying to do is get a banded distraction at this hip. You won't really feel this one as much as the hip flexor or the pigeon stretch, but a lot of times if you have that pinching type pain or a lack of mobility with internal rotation, it's a problem with functional movement, squat, deadlift, lunge. Okay, so definitely work on that one. All right, the next thing you're gonna do is a hamstring. So with your here, all you're gonna do is stand up, but you're gonna have your face and everything away from the band attached to the wall. All right, now what Haley's gonna do is she's gonna step out with the opposite leg. She's going to really focus on keeping this knee straight. All you're gonna do is allow the band to pull you back when you actually bend over, because we want a hip hinge here. Good. Look down, because I want to have this to stretch also. Okay, now your goal is to reach to the outside part of this foot with the other hand. So in this case, her left hand reaches the outside part of the foot, because there again, we want opposite hip stretching to that opposite arm. If you can, bring this arm up to the ceiling. This is like a beautiful yoga move. Now here again, you can torture yourself a little more. Try to flex your quad on the leg that has the band in it. You should feel a pretty big hamstring stretch. Remember to focus on your breathing. These are tough, but they're super, super effective. So what I have Haley doing is there's a foam roller right here. She even has her fist on top of her head just to kind of give her a little bit of, so she's not super flexed in that mid back, because if you're rounding here in this thoracic spine, it's going to be really hard to try to get that shoulder blade to actually move across it. So if this is too much for you, then go to a bench or a box or something like that, or you can even do it on a wall. Now, what we're gonna have Haley do is reach with her left arm. Here's the reach part. She's going to roll, thumb is gonna go up, should have an external rotation here in the shoulder so it gets nice and tight. Then she's going to lift. She wants to think of this shoulder blade coming back to the other lower back hip area. Hold it for about 2 or 3 seconds, then relax. There again, reach, roll, and lift. Good. This one's pretty darn hard. It looks nice and easy, but it really focuses on this lower rhomboid stability. Now what we're going to do is an exercise called face pulls. So this is a fantastic scapular training exercise that you could do as an exercise in the gym. So you need to have something attached nice and high, kind of about shoulder width, maybe a little bit wider, depends on how your shoulder dynamics feel, so it's comfortable. And what you're going to do is you're just going to pull it toward your face, squeeze these lower shoulder blades together, and then relax. So this is a nice controlled movement. Try to bring it down. Good. Hold and relax. So think of almost, this is a fantastic one to use when you have one of those little tricep ropes. You grab it and you almost pull it right towards your face and you're squeezing those shoulder blades back. Do about 3 sets, 10 to 15. The first one we're going to do is the Turkish getup. So everyone always gets scared of this one, but we're going to break it down into parts. We're going to do the first 3 parts here. Now, just basic, simple mechanics of whenever you're laying on the ground, how to utilize the kettlebell without hurting yourself, how to pick it up. When you're laying on your back, Haley's going to roll over to the kettlebell, grab it with 2 hands, bring the handle to her chest, and then roll on her back, straighten out the wrist. So what not to do is to bend it like this. You always want to have that forearm and wrist, hand all straight. Then she's going to push it up to the ceiling. That's how to start. How to stop, whenever you're done with the exercises, bring it to your chest, roll over, and let go. Okay? Now the first one is honestly the first step with the Turkish get up, but we're going to call this one the arm bar to try to get neck rehab at the same time. Now, number 2 thing to always work on when you're doing kettlebell stuff is your eyes should always be on the bell part. So that's anything that's not the handle, okay? Except whenever you stand, then of course your eyes can go where you're supposed to be looking at. Now, Haley's always going to be here. First step is to push the kettlebell up to the ceiling and go to the other shoulder. So now she has shoulder, shoulder, elbow, wrist. Nice straight line. What she's going to do now is look down to the ground, look back. She's going to do neck rotations. She's going to do 5 to 10 of them. This is trying to disconnect neck and shoulder stability. We're building shoulder stability, but a lot of times people's neck tenses up so bad when they just pick something up with their arm. Okay, now she's going to come back to the start position. So we're going to go back again. Step 1 is just to the opposite shoulder. Good. She's going to come back. Now we're going to go to step 2. She's going to go to the shoulder and then to the elbow. Good. Nice straight back. Back to the shoulder, back to the other shoulder. Now we're going to go to 3. Shoulder, elbow, then to the hand. Nice straight back. Then she's going to do it the same opposite way. Elbow, shoulder, shoulder. That's the first 3 steps of the Turkish get-up. Let's stick with that for right now. We'll build upon it to where you're all the way standing. Remember, when you're done, 2 hands, pull it to your chest, and then roll to the side and let go.